Greetings. My name is Fitzgerald Mofor, and I'm the new secretary for the Montgomery County Taxpayer League. Esther Wells is our president. Gordon Green serves as our treasurer, and our board members consist of Ann Hinstein, Joan Fielder, and Lee Henry. You can catch our website at www.mctaxpayerleague.org and also get to our Facebook at MCTL and also reach our Twitter and X account at MoCo Taxpayers and also email us at presidentmctl@gmail.com. The objective of the Montgomery County Taxpayer League is to educate and advocate for county taxpayers. We support appropriate actions to achieve greater efficiency and effectiveness in Montgomery County government and tax equity for county taxpayers. Our vision is focused on performance and outcome. We host presentations with local elected and appointed officials on topics which have an impact on the county's finances and consequently our taxes. We also take part in various public meetings and other advocacy. Upcoming meetings to please mark on your calendar are Tuesday, 19th, 2024 at 7 p.m. with the new MCTS Superintendent Thomas Taylor. And also Tuesday, December 3rd, 2024 at 7 p.m. with Councilmember Balcom, who's also a member of the Economic Development, Transportation, and Environmental Committees. Open leadership positions and volunteer opportunities are also open to MCTL, so please get engaged. Also, please reach out to us if you are aware of community events and any other engagement opportunities. Additionally, we are soliciting $25 annual membership dues and donations as well. Now that we've covered MCTL and our endeavors, I would like to introduce our guest today, Councilmember Gabriel Albornoz. Gabe is a lifelong resident of Montgomery County and is deeply committed to the county, its people, and is a son of immigrants and its diversity. He also graduated from Montgomery County Public Schools and has dedicated his career to public service and advocating for social policies. He graduated from Walt Whitman High School, received his Bachelor's of Arts in Communication from the University of Maryland, and earned his MBA from Johns Hopkins University. In November 2018, Gabe was elected to the Montgomery County Council as an at-large member representing more than 1 million county residents. In 2021, he served as county president and chair of the Health and Human Services Committee, where he oversaw public health and human services that impact children, adults, and seniors in Montgomery County. Gabe previously served on the Public Safety Committee, where he reviewed current policies to maintain transparency and increase the accountability of public safety departments. He also worked on policies for first responders in order to provide first-class resources to the county police, its Department of Fire, Rescue, paramedics, and emergency operators. In November 2022, Gabe was re-elected to the Montgomery County Council to reprise his role as an at-large member and chair of the Health and Human Services Committee. He also currently serves on the Education and Culture Committee, where he will manage issues in partnership with Montgomery County Public Schools and other local organizations to expand access to equitable, quality learning and career advancement opportunities for young people, individuals with disabilities, and adults. Gabe is truly at large, having lived in Gaithersburg, Silver Spring, Bethesda, and now Kensington, where he lives with his wife, Catherine, also a Montgomery County native, and their 4 children. We welcome Chair Albornoz. Thank you for joining us in this evening to discuss the county's health and human services and answering questions submitted from the community. We hope this meeting is first of many conversations and engagements. Thank you.
Thanks, Fitzgerald. Great job.
Thank you. Yes, and sure, I would love for you to give an opening on some of the things that you guys have been working on at County Council, and then we can jump into the questioning parts of the
presentation. Absolutely. Well, first, a disclaimer, as you mentioned in your intro, I do have 4 kids. They are all home right now, and so if you hear some craziness in the background, nobody's being tortured. They're just being encouraged to do their homework. And we also have a dog, so if he makes a cameo appearance, as he is right now, my apologies. Life happens. But thank you all so much. So I was thinking about this as I was preparing for tonight's presentation, and let me just say a few things. First, thank you all. So unfortunately, too few of our county residents are particularly engaged and know what's going on. And so it's critically important that you all continue your work and hold us accountable whenever you testify before the council. And Gordy, you do a fantastic job, my friend. All of us put our phones down. We concentrate, we focus on your all's presentations because we know how well researched they will be. We know how well thought out they will be, and we also know how thoughtful they will be. So just keep up the really great work. And last thing, fun thing, before I talk a little bit about my role as HHS chair, I've been a Montgomery County taxpayer since 1988 when I got my first job delivering the Gazette newspaper when I was in middle school. So I have been a Montgomery County taxpayer as long or as almost as long as a lot of you on this Zoom. So truly, thank you for your leadership. So um, if we had done this presentation a week ago, I probably would have been very different than the presentation I'm going to give you all this evening because of what transpired last Tuesday night. Because the world has changed very significantly. And let me just say from 30,000 feet, I have been working in the county when we went through the recession, when we went through the first 4 years of the Trump administration, and when we went through COVID. And all three were very tremendous challenges in a myriad of different ways. But let me just say that good things did come out of those difficult times. And what I think it showed me was the power of partnership, thinking outside the box, and doing more with less, which is what we're probably going to have to do for the foreseeable future. So I very much respect the spirit from which you all have done your presented your questions, because I couldn't agree more on the importance, particularly now, of finding efficiencies and making a dollar out of 15 cents wherever we can. So really, really understand that, and there's a heck of a lot we're going to have to do. So within the Health and Human Services space, as you all know, the Health and Human Services Department is the largest department in the executive branch based on the number of staff and personnel that they have. There are over 1,400 HHS employees, and there's a myriad and wide range of these positions, ranging from medical professionals, doctors, PhDs, to folks who are providing background services and everything in between. And so it's a very large and diverse agency whose full scope people don't always understand or know. Clearly, they do administer programs and services themselves, but they also administer the most amount of grant contracts of any of the other county agencies combined. And so they have a fiscal responsibility and a very significant administrative responsibility to oversee the contracts of a number of different nonprofit organizations in the county. They also have a regulatory component. They are responsible for providing certifications and overseeing our restaurants. And they also, believe it or not, are also responsible for approving our public pools and our pools in general. And so there's a wide range. The other department that we also oversee in the HHS committee is the Office of Human Rights. And I'll also mention, and then I'll transition into some of the priorities within HHS, is that HHS has a number of partnerships and alliances with sister county agencies, but in particular Montgomery County Public Schools. And of course, our school health nurses are actually Health and Human Service employees, but obviously they are housed within MCPS. And linkages to learning, as you noted in your questions, is actually an HHS run program, but running out of Montgomery County Public Schools. And to put that in context, we recently received a presentation from our central staff in partnership with MCPS that underscored the amount of investment that the county provides directly to children, youth, and families, to students in the MCPS system that are not MCPS dollars. And so we do, as you all know better than anyone, provide what we try is a well-rounded 360-degree investment in the whole child, not just what's going on in the classroom, but what's going on throughout their entire life. So that's important to note. I have been the chair of the committee now for 6 years and followed the great work of Councilmember Leventhal, who was the chair of the committee for 16 years, which is extraordinary. He's one of one because no other county council member will serve 4 terms. But what we focus on as a committee is to try to be partners with the agency. Clearly, our role is to have oversight capacity. It's a role we take very seriously. We hear annually from the 72 boards and commissions that are directly related to HHS, and they often make recommendations and have feedback on HHS services. We are trying to ensure that they are spending dollars effectively, and we do often review outcome measurements of direct programs and services. In the health and human services space, it is a little bit more complicated because often the outcomes are not something that you can look at necessarily year over year. They have to be longitudinal studies for you to be able to get a full scope and understanding of the impact of the work that they are having. But there are certain benchmarks, particular, some of them obvious, the number of vaccinations from one year over the next, the number of diseases that we're seeing, the HIV rates. And what we see in many instances, sadly, is that the numbers are disproportionately negatively impacting our Black and brown communities. And so we have been focused on efforts to increase prevention and intervention. And we have been working with Dr. Bridgers and his team, and in particular, Dr. Keisha Davis, our public health officer, to gather information whenever they do public health surveys. And in this most recent public health survey that came back to us, the number one issue that our county residents raised as a chief concern of public health was behavioral health, mental health, which I expect to go even higher. And there has been nationally, for example, a 700% increase to LGBTQ plus crisis lines. And we haven't gotten those numbers yet in the county, but I suspect those numbers have really significantly increased here as well. So last few things I'll mention in terms of our priorities are, one, we are in the process right now of tracking all of the federal funds that we believe could potentially be in jeopardy during this next administration, to try and get a sense of magnitude and scope and see, where that goes. We have already heard from MCPS and Dr. Taylor, who is beginning to do his review of the federal grants that MCPS receives. And obviously it would be catastrophic if we lost even a small percentage of those. But it's in HHS in particular that we're deeply concerned. The second priority that we are focusing on is how are we going to help ensure that we provide support, not just for HHS, but for our health clinics, our hospitals, our nonprofit organizations, that we focus in the area of recruitment and retention of medical personnel, and that we ensure that that medical personnel reflects the diversities of the communities we are serving. Where we have the biggest gaps are in the area of social work and also behavioral health. And those are areas that we are working on to try and ensure that we continue to recruit the best and the brightest. We are doubling down on partnerships with Montgomery College and the universities of Shady Grove. We've also passed policies over the last several years, making it easier for our newly arriving constituents from other countries that may have medical degrees to make sure that they are more easily transferable so that they can begin providing high quality services here in their own community. And the third thing that we are also focusing on right now is how we can reinforce our partnership at the state and federal level, and municipal, because we are going to, just as we did during COVID, just as we did during the recession, we are going to have to circle the wagons and be much more strategic and aligned in how we are leveraging our resources, asking for more. And we are also going to have to actively engage our philanthropic community, which stepped up in a very significant way during COVID. And we're hoping continues to make investments here. And we keep reminding our philanthropic community there is just as much need in Montgomery County as there is in the District of Columbia, as there is in Prince George's County, as there is in the city of Baltimore. And so, as we all know on this call, the roads in Montgomery County are not all paved in gold. And so we do have to continue to ensure that we are supporting our most vulnerable residents. I always say last thing and then I remember something else, so it never is the last thing. So I won't say last thing, but a couple more things, and then I'll turn it over to you, Fitzgerald, to help facilitate the questions that your colleagues may have. HHS, I believe strongly, obviously touches every part of our community. And whether it's pedestrian safety, whether it's addressing the increase in fentanyl use, there is a lot that this group of really dedicated individuals does that is not seen, is not heard, but is having a tremendous impact. And so if any of you have the opportunity or come across a staff member from HHS, please express your appreciation for their work, because it is often unsung and not appreciated enough. So that's just a random thought, but an important one, particularly as we get go through these next few years together. So, but I'll pause there. I know that you all had over 48 questions that you had raised. I didn't know in what order you wanted to try and tackle at least some of them, or whether it made more sense to do a free flow right now. I am at your disposal. So however you'd like to do this, Fitzgerald, happy to do it.
Well, thank you so much.
Cheryl, before you start, I do want to congratulate Councilmember Albornoz on one particular area of HHS, which is, I think, the Family Services Division.
Yes.
We have a son who has Down syndrome, and he lives in supported housing. And once a year, we have a meeting with someone from HHS, from that division, who actually looks out for what is happening with him throughout the year. She is so good. I wish I could send you her name, because people like her are often not acknowledged, but she asks very pointed questions every year of all the people who are providing him services. And if she is indicative of the rest of the staff, all I will say is you have a very good unit over there. This is dealing with, I think it's called the Family Services Division. I'm not sure.
Absolutely. Thank you, Joan. I'll pass that on. That's very good.
Please pass it on.
I will.
Okay.
That's fantastic. That's awesome. But I just want to say thank you so much, Councilmember Albornoz, for a very strong and robust opening to describe and delineate the responsibilities of your office and chairing HHS. And thank you so much for attending and being very interactive with your constituents and other community leaders that have a myriad, as you said, different questions that they may want to ask you. So,
and actually, I forgot to mention, Fitzgerald, I should have started with this. I am joined by my colleague and friend, my Deputy Chief of Staff, Kristen Tribble, who's on the line. I have the best team in county government. I'm just going to tell you that right now. My Chief of Staff is a clinical licensed social worker, and she's awesome. And so Kristen Tribble is my deputy. Pam Luckett is also on our team, and Jackie Rivera Oven. So we are small but mighty, and I just wanted to express that appreciation. I can't do any of this without them.
No, thank you. And I would also say thank you to them for also joining and their great dedication to public servitude as well. And so now we're going to actually begin the questions portions of our presentation. And I have a few questions lined up, and all the attendees, they can virtually raise their hand if they want to jump in and ask any questions too as well, and then I'll acknowledge them, and they can open up their mic and go in and ask any questions that they may have. But the first question that I have regards to the MCTS supplement, and HHS share of county spending in MCTS $350 million. That doesn't appear in its budget is significant once debt services is included. How does HHS spending link to improve student proficiency in reading and math and specific MCTS strategies that will move the needle for low-income students? For example, how much does linkage to learning improve student proficiency, and what is the cost per student served?
Thank you so much for that question. It's a really good question. So I think HHS, although obviously doesn't provide direct services with regards to reading and math, they help ensure that students are in a better position to be able to absorb the learning. So especially in the area of behavioral health, mental health, which is an area that we've been really focusing on, particularly through our linkages to learning programs. We've also added health and wellness centers to a number of our high schools across the county. The area that we need, I think, moving forward to focus even more on than we are right now is at our middle school level, where there seems to be a dearth of programs and not enough support. When I was the director of the recreation department, we launched Excel Beyond the Bell during the recession, and we started from the middle schools because we saw even then, this was almost 16 years ago, that there was a dearth of programs and services there. So I would say that HHS is primarily responsible for addressing the social and emotional need, or in a better position to help address the social and emotional needs of the students, and then also helping with both physical and behavioral health too. And I think it's important to note also that HHS, through our street outreach network, which is led by Luis Cardona, they are working closely with kids that are gang involved or that are severely at risk. All kids are at risk. But there are some kids, because of their circumstances, are even more so. And so they do a lot of prevention-based work, but they also do a lot of intervention-based work too. So for example, if there is a shooting in the county involving a young person, it's not just law enforcement that responds to the immediate incident. They often will refer the siblings that may have witnessed or been present or somehow involved, the friends that witnessed or were present or were somehow involved. They will refer them to the street outreach network, who will engage those students, will talk to those students, will make sure that their needs are met so that the violence that occurred isn't escalated and continues. It's not perfect, but they have been able to intervene in numerous situations and prevent them from becoming much worse than they already were. So those are some ways that HHS is supporting kids in classrooms by supporting their other needs as well.
Yeah, which we understand are very linked with one another. So we really appreciate your very thoughtful answer to it. And we also want to reiterate, if anyone has any questions that they would like to jump in, please raise your hand.
Yeah, if I could, this is Gordy, Gabe. You mentioned Councilmember Leventhal, who served for 16 years as chair of the HHS committee. He was involved in the early launch of linkages to learning, and he challenged I think at one point, this was probably 8 years or so ago, the council was wrestling with the cost of linkages to learning. And Councilmember Leventhal questioned whether or not we could afford to expand beyond the Kennedy cluster. And I'm not sure if it was the Watkins Mill cluster or one other, but there were only two clusters where linkages to learning existed at that point. Do you have any history since you took over the chair of the committee on how we've cost justified expanding to other clusters?
Yeah, good question. So I don't have them right now, and I can follow up with you in a subsequent, or I can send you guys an email. But linkages does have pretty robust outcome measurements. They've actually done a good job of tracking outcome performances of their various programs and services. And so the program has been replicated. What they've also done is schools often ask for the program. It's not just helicoptered in and then set up. It's formed through a partnership and alliance with the administration of those schools. One thing I've learned in doing this work now for almost 20 years is how important the role that the principals play in the administration of these programs. So you may have a great program, a great curriculum, a great staff, but if there isn't a true partnership and it's not like an appendage of a school, but actually like part of the school, then it's not going to work as well. And so that's an important component of their model. And that's how they've expanded. I actually don't know the answer to how exactly many schools they're in. I can get that for you. But it's funny you mentioned the Kennedy Cluster Project and the Watkins Mill Project. That was the first time I had the opportunity to work with Dr. Jerry Wiest, when he was still around. And I always remember him saying in that North Carolina drawl, Montgomery County is resource rich, but communication poor. And he was right. He was right. And that some of that still stands, sadly.
Again, just emphasize a point you just made, because we're meeting with Superintendent Taylor in a couple of days. The point that you made about how programs like Linkages to Learning succeed or fail based on how strongly the principals support the programs, and as you said, actually draw the programs in, and they manage the programs. They participate in ensuring the success of the programs. That's going to be a key message and discussion point when we talk to Dr. Taylor. So much of the blueprint, so much of the counties and MCPS strategies focus on teachers, and yet we forget about the role of management. Yep. And as a former director of Recs and Parks, I know you know how important management is. So thank you for saying that.
Yeah, absolutely.
Thank you. Thank you to those who joined. Again, we're meeting with Councilmember Albornoz, and we're in our questions portions of their presentation. And for those who joined, raise your hand and jump in with questions too also. So the next question that I have for Councilmember Albornoz is that HHS and MCTS has the fastest budget amount in county agencies. How much spending for older strategies linked to the pandemic have been evaluated for effectiveness? And how do you analyze spending in the base that's not broken out the way of incremental increases?
Yeah, another great question. So, as awful as COVID was, it really did teach us a lot, and it forced us in ways that were really uncomfortable at the time to analyze things in ways we hadn't before. So, and I think, there were numerous really positive examples of that. Our African American, our Latino Health Initiative, and our Asian American Health Initiatives, all three did really amazing work during that period and helped. Because one of the things that I've also learned in doing this for this long is government's important. It can do a lot, but sometimes and oftentimes it's those community connections, those community-based organizations, those important critical intermediaries are in an even better position to track the performances and to help organizations who are administering and doing the work. And it's a unique model to have these three entities actually have funding and a line item in the budget, but it's proven to be very effective. And one of them I'll just focus on for now because it's the one I'm even more familiar with is the Latino Health Initiative that started a program during COVID that significantly increased the vaccination rates among our newly arriving residents, helped break through the misinformation that we were all receiving from our uncles and aunts and social media at the time, to be able to let folks know vaccinations were safe. And it really made a huge difference. And it also launched a health promoter program in which we have a small army of these incredible individuals who go through a certification process and take classes and then use that certification to work on behalf of the county to reach hard to reach communities and to share resources, make referrals, establish contacts, build trust. They've been doing really effective work. In fact, it's been so effective that it's being expanded, but I think that same model can be used in other program service delivery areas because we've got these great services, but sometimes people don't know about them. They don't know how to access them. They feel overwhelming. And so it's important to make those investments in those folks that can build those bridges. So those are some of the ways that we've been tracking outcome measurements and performance since COVID. But some of it was born because of COVID. So, and it looks like somebody has their hand up.
We have Andrea McDonald that has a question. Please, Andrea, if you can unmute yourself and introduce yourself too as well, and go ahead and ask your question to Councilmember Albornoz.
Good evening, everyone. Councilman Albornoz, thank you for this opportunity and the invite for us to be here tonight. My question, and I think it kind of follows from what you were saying, speaking of things that emerge during COVID. And one of the things that I wouldn't say it was a response to COVID, I would say that it was something that, I'm speaking of the Montgomery Virtual Academy. It was something that, because of how great of a need they saw the blended learning fill a void that existed, this just went ahead and said, okay, well, we were thinking about doing this, so let's go ahead and greenlight that. That program has served so many. It has served so many in, especially the community that you're referring to as the one that is, I'd like to say, overwhelmingly disproportionately affected. I'd like to say the Black and Brown community. And that seems to be the soundtrack of education, not just in Montgomery County, but across the country. To see that that program had thrived, what it had become, and to know that the program had since been closed, once again, it sounds like it's a line item that was just eliminated from the budget, thinking that it was going to meet this need of fixing the budgetary shortfalls, but then it turned around and we saw 297 plus our families just leave the county because the closure of that, and the other students, many of whom were forced back into classes and some of whom are just electing to do homeschooling. My question for you is, whether you know or not, has anyone from MCPS reached out to, whether it's your street team or whomever, to bridge the gap or provide some kind of a cushion for those students who have returned in person, who are experiencing an overwhelming feelings of anxiety and all of the mental health stuff that's coming there, and vis-a-vis extend that to their families at home who are now fearing for these children's safety, et cetera, in light of the climate that seems to be plaguing our schools, not just in Montgomery County, as I said, but across the nation. But how does that factor in with HHS, MCPS, and meeting those needs? Or do you have any information to that?
Sure. Well, thank you so much, Andrea. So, you know, reading about and watching that situation, and I did speak with a number of the families who were impacted by that, because I also serve in the Education and Culture Committee. It was heartbreaking because you're right. It was a program that clearly hundreds, if not thousands, of our students were taking advantage of, thriving in, really needed. And while, as you all know, the council does not have direct line item authority over programming within MCPS's budget, we just basically write the check, but they decide how to spend it. We do obviously have influence and a role to play. And I will say that immediately upon, once he came on board, this was an area that Dr. Taylor leaned into and focused on, and did have a meeting shortly into his tenure with those families. and acknowledged publicly that the situation was to say it, mildly, was not handled well, and was egregiously not handled well. It just was too much of a shock for those families. And if we were going to make that transition, it should have been over the course of an entire school year, not just a letter that comes, a couple of months before the school year starts. Families were scrambling, they were confused, they were receiving conflicting information because they weren't receiving just appropriate or complete information. So I just want to acknowledge that and let you know that we were deeply concerned on the council as that situation was arising. I think Dr. Taylor will be in a better position when he comes and speaks to you all next month to give you an update on where that situation stands. What the council had asked for was a complete review of what transpired, and we wanted information on what is happening with those families and what supports are and have been or have not been provided. And I think that will be important to note. With regards to Health and Human Services, obviously it's a couple of degrees removed from that specific situation and those specific students, but many of the behavioral health support services and support services in general are provided by HHS. And so I would hope, but I will follow up and confirm that those services were referred to the families for them to be able to access. But I don't know if that happened, and I don't know if they accessed them, but I will find out.
Thank you.
Yes, thank you, Andre, for that question, and thank you, Councilmember Albornoz, for the very long and in-depth answer too. Also, and it looks like we have one more person too that has a question. They have their hand raised. So, Candy, you can unmute yourself, introduce yourself, and go ahead and answer.
Sorry. Hi, my name is Candy, and yeah, I'm also a parent who my children went to the MVA, and I had ended up sending my son back to school, the public school, and it's kind of like a culture shock for him. He's witnessed like students trying to violently harm staff members, and he'll come home and tell me, and I'm like, well, how do you feel about that? Do you feel safe in your schools? And he does not really feel safe in the school. That's like a big thing. We do pay like a lot of taxes to live in Montgomery County for our children not to feel safe, for our communities not to feel safe, and for them to just take away the MVA where they were safe, where they did have a safe space to express themselves, to grow, and they were doing so good. And I'm just wondering, when are you guys going to bring it back? Because a lot of people Frederick has virtual academy, so why can't we have it?
Right. Thank you for the question, Kenny. I don't have that answer. I think that when you all meet with Dr. Taylor, it's something you all should advocate for. We've certainly, we will ask for a complete evaluation and get a briefing on his review of the matter, because he has looked into this and did say that he was going to come back with some solutions. But I think he'll be in a better position to answer that. But
he did. He came back with something, but it's not fitting.
Oh, okay. Okay.
Yeah, it's not fitting.
I appreciate that. We'll follow up. Kristen, who's on the line from my team, we'll see where that currently stands. But to your broader concern about safety, yeah, that is a huge issue, and one that's obviously complicated and has a number of different layers, and HHS does play a role in that for sure. But that's something that we as an entire community are going to have to wrestle with, because it's one of the biggest reasons why the truancy rate is as high as it is, because MCPS has done a number of surveys, and the reason why so many kids are not showing up for school, which speaks to your point, Candy, is because they don't feel safe. And that's unacceptable, completely and totally unacceptable. And we have to address that from multiple angles. And I've been working on something in that space that's not ready for prime time, but it is something that I've been focused on as well.
Yeah, thank you guys for your great questions too. Also, And again, thank you, Councilmember Albornoz, for answering those questions too also. And we always want to remember to let individuals complete their sentences before interjecting. But we will also continue on with strategic budget questions. And another question that I have for Councilmember Albornoz is that having benchmarking studies been done that compare costs to other counties in the area, and how can spending be broken out by strategy so that taxpayers can see what they're getting for their money?
Yeah, that's a good question. We need to do a better job. I'll answer the second part first. So, we can't criticize MCPS for not being as transparent as they need to be, and not do a good enough job ourselves. So we have a really cool tool within the county council called the Office of Legislative Oversight. OLO is sort of like the think tank of the county council. And they are amazing, and they do a lot of really great work, and often their work leads to policy recommendations. And I think based on what you all just said and your suggestion, and I'll follow up with our team on this, but I'm going to request that OLO help us see through benchmarks in other jurisdictions how better we can present the overall HHS budget so that it's easier to digest and process. It's a little bit challenging because some of it is intermingled with other programs and services, and oftentimes HHS programs have federal and state funding in addition to county funding, but there's got to be a way that we can make it easier and more accessible for folks to be able to process and digest. And so that will be a project that we will work on, and maybe a year from now, when I come back and speak to you all, I'll have some more information about that.
Yeah. Transparency is definitely key. And again, for anyone that has any questions, go ahead, jump in, raise your hand, introduce yourself. So the next question that I have for Councilmember Albornoz, which still is part of our strategic budgets portion of the presentation. The question is that strategies are different from programs, and programs should have multiple strategies to accomplish performance objectives. Key questions we have for every strategy but can't find in the budget are: how many residents are being served by each strategy? What percentage of eligible residents are served? And how is the strategy improving their lives?
Yeah, so that could, you may have just set up the structure for the OLO recommendations. Those could be the line items. Those are, that's very astute. So we do have that, not across the board, but some programs do a better job of tracking outcome and performance data than others. Some of that, frankly, is sometimes when we receive federal funds, there are requirements for those funds for us to be able to clearly demonstrate that response, those results. So, but we should obviously be doing that across the board. And, so there's a lot of things too. For example, Montgomery County is for the third year in a row the healthiest county in the state. Well, that's great, right? But what does that really mean? And what metrics are they using to make that determination? And does that really tell the whole story? No, it does not. We still have very disproportionate health outcomes among our Black and Brown, but also in Poolesville, for example, in terms of geography, Poolesville has the poorest health outcome measurements in the county. And part of that is because it's a rural jurisdiction. It doesn't have as much access to some of the same public health infrastructure that we have in other parts of the county. And there's a really amazing group of advocates led by a couple of friends of mine in Poolesville who, through WUMCO, which is the acronym for, I can't remember what the acronym stands for right now, but they have been actively advocating for enhanced public health infrastructure. And I really want to give my colleague, Councilmember Balcom, who you'll hear from later this year, she's been a bulldog on this and really focused on it. And we've already started to see some evidence of, some important growth there. One other thing I should have mentioned that is a priority that we're focusing on in HHS is strongly encouraging the department not just to have county residents come and find them, but for them to find county residents. And we're doing that, for example, through our mobile medical units, because we have to, one of the greatest barriers to accessing public health is transportation. If you've got to take 2 or 3 buses to get to your dental or medical appointment, and you've got a couple of kids that you're taking with you in a stroller to get to those appointments, you're going to be a heck of a lot less likely to go. And so we have to make sure that, for example, and we're doing this right now with Ride On, is, you know, our public transportation infrastructure was built primarily around getting people to and from work, but it was never focused enough on getting people to and from their appointments and to go help them go about their daily lives more efficiently. And so one of the focus areas that we've asked the Department of Transportation to focus more on is making sure that we have lines that are more easily getting to hospitals, more easily getting to our public health clinics, and some of the emergency care facilities, so that, you know, it makes it easier for people to be able to access. So I just forgot that at the beginning, and I wanted to mention it because I think it's really important.
No, thank you for that answer, and also thank you for mentioning some of the subgroups that are disproportionately affected due to the lack of, I guess, access, so to speak, to robust social infrastructure, et cetera, and so on. Which also leads me to my next question too, also, is how many Black students are needing mental health services, and how many are successful completing services, and what outcomes can we share? And that could also fall under the guidelines of maybe students from rural communities or Latino students or other disproportionately, or I should say disenfranchised communities too as well. But sorry for that long explanation. Hopefully it didn't detract you from the question.
So I appreciate that question a lot. It's very near and dear to my heart. So we just approved Dr. Monica Martin, who is the new chief of behavioral health services in the county. And Monica and I go way back. I've known her for almost 20 years. And I don't have that information at my disposal, but I will follow up with her and get that information. But sadly, Fitzgerald, it won't surprise you that the numbers that we're seeing in terms of behavioral health challenges and issues and mental health challenges and issues within our Black and brown communities, but in particular our Black community, are higher, significantly higher. And we know that based on the number of people who are calling our crisis hotline. And we also know that, you know, based on the referrals that we're seeing through our juvenile justice system, and too often students that enter into our juvenile justice system, for many of them, it's the first time anybody has assessed their behavioral health needs. And by then, obviously, it's not too late. We certainly have a lot more that we can do, but it's sure as heck, from a taxpayer's perspective, going to be a lot more expensive to address the mental health needs of a student who has already entered into the juvenile justice system than it would be had we gone much further upstream and addressed their needs earlier. And speaking of earlier, another area that we're really going to have to focus more of our time and attention on is at the elementary school level, because we are seeing really significant behavioral health issues there. And there are no social workers, no counselors assigned to any of our elementary schools. They're all assigned to middle and high schools. So our poor teachers and administrators are basically on their own, trying to address the myriad of needs of the students that are coming into their classrooms. And we know that that can have tragic consequences. And it's something that we have to really address much earlier, but also help the families to be able to address those issues much earlier. Because oftentimes, you know, the parents or guardians are overwhelmed and don't know what to do. They're just don't know where to turn. So those are some areas that we're going to have to focus on. And as I said, they're sadly disproportionately impacting our Black and brown kids.
Absolutely. Thank you.
I'm raising my hand physically here because I don't know how to operate the hand raising thing electronically. But you've stimulated a question, Gabe, and I'm pleased that you elaborated. There's a wonderful integration between MCPS and HHS for service delivery. That is a rather recent phenomenon. And I applaud your efforts to make it more of a reality, because clearly MCPS is the place, the locus, if you will, for many families and parents in particular, and certainly for the kids. And one of the issues that we have when we look at academic proficiency is that there seems to be an overwhelming emphasis on academic proficiency at the elementary school level for literacy, and understandably so. But as you know, there's a high mobility rate at both the middle school and high school levels as well. Kids come into our system without the benefit of a grade school education in Montgomery County. And it seems to me that as you think about the scope of this OLO study, sir, you've opened for us a wonderful Pandora's box. But what I think one of the big issues, given the integration, is I think we're not doing as good a job at the high school level as we are at the elementary and middle school levels. It seems that once a kid comes into the system at the high school level, their academic proficiency is basically a foregone conclusion. And some of that may be due to underlying problems that we can address.
Yeah.
We don't need to throw these kids out after they tried and failed to become a fifth-year freshman in high school. And so I emphasize that. Have you given any thought to this, how we can better expand our service delivery to high school kids?
I've given a lot of thought to it for sure. And you're really onto something there, Gordy. So I'm going to answer this a few different ways, so bear with me. We need a paradigm shift because what we're doing isn't working for all students. And although I wouldn't go as far as to say it's a one size fits all, but for certain sectors of students, we just need to just acknowledge the reality on the ground. And I'm specifically speaking about, and this is one segment of our population, but it is wonderful, and I think a good thing, that so many newly arriving constituents are coming to Montgomery County to start their families, to grow their families, and I'm happy they're here. But for a number of the students, they in some cases have had 2 or 3 years of education disruption. They're coming with lots of behavioral health challenges. They're coming with trauma. And we're trying to integrate them into our public school system. And these schools are not equipped to be able to handle the very complex and very deep-rooted needs of the students that are coming in. And so they're failing, and they're not succeeding at the level that we need them to be able to succeed. We need to look at other models for some of these students. For example, in the District of Columbia, there is a model for students that are newly arriving, where they go to a different school for a couple of years before they are integrated into the school system, where they receive more wraparound services that are more appropriate to meet them where they are. Or we have a lot of students who actually have to work to be able to support their families. And so we need to make non-school at non-traditional hours. And we do have some of those programs, but they often don't provide the same level of support that the students are getting during the day. So the students that are attending evening schools or schools on the weekends don't, for example, have the same access to counselors or social workers. We have to, and those are probably students that need them even more. So those are some areas that I think we're going to have to make some, and these are not necessarily additional dollars. Like, we just need to be more strategic with the resources that we have and change the paradigm.
Well, Gordy,
So I'm so sorry. I don't know how to raise my hand either. But if I could piggyback, I want to just thank you for some of those ideas that you just shared. And I won't get into specifics. We are not newcomers, but we have experienced violence and trauma. My son was formerly with the MVA, And that was actually a really, really good option for him, because in person, there were certain things that were happening that were kind of triggering him. And so I wonder if maybe MCPS had a good option that was of the kind that you were describing, but that's gone now.
Yeah, it's a good point. It just reinforces you all are spot on. So I would put that at the top of the list when you speak with Dr. Taylor, because I think in principle, I certainly can say I'm there, and I would encourage the school system to be there as well.
Yeah. Thank you guys. Thank you guys for the great engagement. And I truly appreciate your questions. And I actually want to interject this question here in the chat, and I think it's a pretty good question. And I, would love to hear Councilmember Albornoz response to it. So this is from Andrea McDonald, and I guess this is maybe a suggestion, so to speak. And she says, maybe some wrapped around services can be brought to the brick and mortar schools to meet those students' needs. Is that a possibility, or what's the viability like in terms of getting that done?
Yeah, so that is the intent of linkages to learning and health and wellness centers. So they do exist. That's the good news. But I think that too often their caseloads are bigger than they can handle. But having said that, one of the areas that we're going to have to focus on, particularly these next few years, is doing a better job of leveraging other programs and services so that we can make more seamless referrals. If they can't provide those services, then what are other organizations within walking distance of the schools that may be able to absorb some of the work, so that we have some options for families, other options for families. But yeah, we have added social workers to our MCPS system, which are obviously very important. And there's other areas that we're going to have to provide for wraparound services as well.
Yes, and Councilmember, you said something that was very captivating earlier too, and it also leads. Oh, sorry. Before I continue, Candy has her hand raised here. Candy, please introduce yourself and go ahead and ask.
Hey, sorry. My name is Candy. So I also have a son who has autism, who's in the public system. He was in our children.
Candy,
Yeah.
you're breaking up there a little bit.
Did we lose you, Candy? Okay. Yeah. I think we lost her. Yes, but Candy, once you get connection again, and once we can hear you, please jump in and continue to deliver your question. But
they make it extremely Montgomery County that we need for yes. I'm sorry. Can you hear me now? Okay, sorry. So they make it extremely hard to get other services that we need outside of the school. As a parent advocating for her child.
I'm sorry, Candy. If you can please.
They make it extremely hard to get. Oh, can you hear me now?
Yeah. It's just a little choppy, so it was kind of hard to hear what exactly you are articulating.
Okay. What about now?
Yes, you're perfect now. Much better.
Okay, great. No, so they make it extremely hard for us to get services outside of the school system. They gaslight us. They don't listen that for what our children need, as if we don't know our own children, and that's another issue, because there are many services for children with autism in Montgomery County, but it's hard to reach them because the school blocks us from reaching those programs.
That's good feedback. I appreciate that. And thank you for sharing that, Candy.
So thank you guys. Thank you so much. And we really appreciate that. And we're going to go on to the next question. And as I said earlier, you said something that was a little bit captivating, and it kind of leads to the next question that we have. And you said one of your priorities are to ensure that the personnel, especially in mental health, reflects the diversity of the county. And leading up to an additional question, or part of that, essentially, I would love to say is, how many mental health professionals are African American or other minority demographics, and could increasing these numbers also increase the effectiveness overall of the service?
Yeah, so I don't know the number specifically. I can tell you it's not enough, whatever it is, but it certainly isn't keeping pace with the percentage of clients that they are seeing. But I will say this is sort of a good news, I think. So the Black Physicians Network, which is another one of the initiatives that was born out of COVID, has continued their work, because what we know, and studies have shown this conclusively for a number of years now, and Dr. Davis, our public health officer, often reinforces this, is when we go to doctors or medical professionals that understand us, that see us, that have, in some cases, just understand our situations, if they look like us, then we have better health outcomes. I mean, it's just a fact. And so we, through the Black Physicians Network and a fund that we have established, we are helping to ensure that more of our Black physicians are seeing more Black patients by subsidizing their visits to those practices, to be able to make up for whatever loss there is in patients that are underinsured and not able to access those services because they just don't have enough resources to be able to go. And we think that's an important investment, because it will enhance not just the public health of the individual that is going to the doctor, but the public health of our community as a whole. And so that program's been a big success. And I know that we are going to continue to invest in it. And it just underscores your point that we need more medical personnel that reflects the diversities of our communities.
That's excellent. Yeah. Thank you. Thank you so much for that answer. And again, if you guys have any questions, raise your hand virtually. Oh, here we have another one from Andrea. Please, yeah, go
Hi.
ahead.
Question that keeps revolving in my head is, I hear all of these great things, and I'd like to say that I'm a parent and an individual who does a lot of research to find out about a lot of resources, et cetera, in our community. However, a lot of what's being said that's available, it sounds very foreign to me. Given that I've only been living in Maryland, Montgomery County specifically, for the past 5 years, the communication seems to be an issue where a lot is not being funneled to families who meet these demographic and can benefit from the services that already exist within HHS and partnership through MCPS. It seems to be a kind of breakdown or a lack of even its existence in communication between the two institutions, or just HHS and its community at large. So is there conversation being had about how to improve that communication so that the information is disseminated the way it needs to be? I can tell you, as a person sitting here, the representation does matter. So I have biracial children, and I just give you a quick example. My son had to undergo an emergency surgery and the blood work was done. The surgeon's med student, well, that was a fellow because they were almost at the end of their study, phoned me to let me know, hey, you need to get him to the hematologist before we can do the surgery. The question is why? Well, his white blood cells, it's very low. Okay, well, if you know, you would know that African Americans' white blood cells are typically lower than the rest of the demographic. Oh, let me run that by the doctor and get back to you. So when I called his pediatrician, she was like, yeah, you need not go do the surgery with them, because if they don't know the basics about your child, and if they need blood during the procedure, then where does that leave you? So I do understand that the representation does matter, and it does a lot in terms of easing anxiety amongst families and when they interact with institutions, HHS, MCPS, whomever it is. I just want to know if there's any communication, or if there's more communication that needs to be had, more conversations that needs to be had about communicating all of what exists with HHS to communities and MCPS, et cetera.
Well, thank you for sharing that example. That's a very powerful, powerful story. But The answer is yes. First of all, we need better communication across the board. I need to do a better job communicating as a council member, as a dad. I mean, like it's hard these days to be able to break through. On the one hand, we have more methods of communication than we've ever had before in the history of our country. Yet it's just becoming increasingly hard to break through the noise and for people to be able to process things in a way they can understand and absorb. So there's three things that I haven't mentioned yet that I think are going to be important for us to focus on moving forward in the HHS space. We often rely as a county government on earned media to get information out, or the traditional methods of emails and newsletters, but that isn't getting to people. And we do have some creative solutions. We do use WhatsApp and we do use some of the social media content, but even that, as you all know, is watered down and it's now overwhelming. I mean, I got more Harris and Waltz text messages than I'll ever know what to do with. I mean, it was unbelievable. How do these people find me? I kept blocking the numbers and like new ones would show up 5 seconds later. It's crazy. It was totally crazy. So people are overwhelmed. They're receiving too much information regarding too many darn things, and it's just exhausting. So that's why I think it's important for us to look at some paid media and go to, people don't get letters anymore in the way that they used to. That's sort of an opportunity for us to be able to, get to folks. But I really want to emphasize the importance of finding those trusted individuals that are willing to roll up their sleeves, meet the community where they are, go to the places of worship, go to the Giant, go to the Safeway, go to the park. That's what we did during COVID. We got off our tails and we went out into the community and it worked. It really did. And so, but we have to do that consistently. And again, I don't think that's new money. I really don't. I think let's look at the communication tools that we're using now that aren't working, and there are a heck of a lot of them. Let's shut those down and let's start utilizing the ones that are. And that also means, I think, reworking some people's jobs in some instances. So rather than sitting behind a desk, like you should be going out into the community. And I honestly believe a lot of those people want to go out into the community. They don't want to be sitting behind a desk. So those are things that I think we can and should be doing more of.
Yeah. Well, thank you. Thank you so much for that response, Councilmember Albornoz. And actually, concluding our presentation, I want to thank the local taxpayer league for organizing this. I want to thank all the attendees for coming. They were great, prepared, and very strong questions. And I just want to allow Councilmember Albornoz to conclude, wrap up, give us any finishing statements, et cetera, and so on, and also how we can help them get their word out to reach out underserved communities too as well.
Absolutely. Well, first of all, Fitzgerald, you did a fantastic job facilitating this conversation. I've had to facilitate Zoom conversations before, and it's never an easy thing, but you made it look seamless, my friend. So you're hired. Good job. And it's great seeing all of you. I know Gordy and Joan have been at this for a really long time. And the next meeting will be at Gordy's place in the Bahamas. He's picking up the tab for everybody. He wanted me to let you know that. So thank you, Gordy, in advance. No, I'm just kidding. But I do want to end where I started, which is in expressing my deep appreciation for all of you and your work. You're doing this as volunteers. You're doing this on top of all of your myriad of responsibilities at home and at work and in your community. And you all are stepping up in a way that's really important, and it's making a difference. I want you to know that. Sometimes I know it doesn't feel like it does, but it does. And so although I went through all of the stages of grief last week a few times, I'm coming in a place of feeling optimistic, truly, that there's nothing that we can't tackle together. And I say this often in speeches, and I mean it. There's nothing wrong with Montgomery County that can't be fixed with what's right with Montgomery County. So thank you all very, very much for this opportunity. I look forward to coming and speaking with you all again and following up on your suggestions and ideas. And I hope you all have a wonderful weekend and that the Commanders win tomorrow night. Thank you.
Thank you, Gabe.
All right. Thanks, everybody.